Hello, Ipswich. My name is Tony Marino. I'm your town manager, and I'm here today with several people. But first off, we're going to start with Dr. Brian Blake, the school superintendent, and Colleen Furman, our public health director. We're here today just to give you another update on what's going on with the town. Today is Wednesday, April 1st. And while traditionally that is April Fool's Day, we're certainly not here to play any tricks on anybody. Today is going to be just facts and figures and let you know where everything stands in Ipswich with regard to COVID-19. Currently, right now in Essex County, as of today, there are 784 cases in Essex County, and currently we have 9 cases here in Ipswich. Given the new orders by Governor Baker, we're going to extend town hall's closure to the public until at least April 27th. We may go a little longer than that, but at a minimum, it's going to be April 27th. We will update you if that date gets extended. Our town employees, like before, are still continuing to work, and they're in the building maintaining the town services for our residents. Most town businesses can be done online. For example, beach stickers, paying your taxes, utility bills, etc., etc. All of those things can be done online. So please continue to use those services. But call us if you cannot, get your business done, or you have any questions with regard to anything, whether it's about COVID-19 or, issues in the town. For anybody who didn't see it, the select board did meet last Friday at 1 p.m. and they've decided to postpone town meeting from the traditional second Tuesday in May, which this year would have been May 12th. Right now they're looking at possibly June 16th, but that's just a penciled in date. That's fluid as we know what's going on with COVID-19, depending upon we can get still meet in large groups and how we would do that and pull that off. The governor has filed legislation to assist towns with their annual meetings, so we can at least get our budget voted before the end of our fiscal year, which is June 30th. But right now that has not been passed yet, so we're still waiting to hear what goes on with that legislation. Again, with regard to select board meetings, we're still continuing to hold them. The select board will meet again this Monday night, April 6th at 7 p.m. They have a light agenda, but there are still things we need to get done, so they'll be meeting to using Zoom, again, that technology that we used last Friday. If you look on the agenda that we're going to post tomorrow, there'll be a link and call-in numbers, so if you want to participate in the town meeting. But we've also utilized the technology here at ICAM, along with our technology, to be able to broadcast that Zoom meeting live. So you'll be showing it on ICAM as well at Monday night, April 6th at 7 p.m. The beaches still continue to be cranes anyway, continues to be residents only on Friday, Saturday, and Sunday from 9 a.m. to 5 p.m. We did it last weekend. We had a police detail out there. I went down and checked it out on Saturday. It was running smooth. A few people from out of town that may not have gotten the message or didn't check the website came down, but they were just turned around and residents were let in. The lot was probably about a third to half full, and people were maintaining social and physical distancing on the beach. So we appreciate that, and please continue to do that. Pavilion Beach is going to be posted as residents only. So please follow the same procedures you would at Cranes if you go down there. Maintain 6 feet, and try to keep the social and physical distancing in place. We appreciate it. So for small business owners, for those who don't know, the CARE Act was passed, the Coronavirus Aid, Relief, and Economic Security Act. It was passed by Congress last week. We have that information with regard to small business owners and what kind of funds and relief you can get through that plan. That is available on our website. If you hit the COVID-19 link, there is a resource area there for small businesses, as well as a bunch of other information, but we do have information on the CARE package, the CARE Act, for anybody who's interested and wants to find out what they may be able to get. Right now, I'm going to pass it over to Dr. Blake, and he will give us an update on what's going on with the schools.
Hi, good afternoon, and thank you, Tony. Schools continue to be closed at this point until May 4th. Our teachers are providing enrichment activities for our students at all levels. The Commissioner has provided new guidelines for remote learning that the administration and staff are currently taking a look at and developing new plans. We are working on those plans to provide a more formal remote learning model to our students, and that's going to look different at each grade level. Many students are already providing this to our students. Many teachers are already providing this to our students. We have Google Classroom set up. We're using the Zoom technology for education. that teachers are touching base with all their students on a weekly basis. So there's a lot of great stuff going on despite not being in the school building. We sent out a survey yesterday to parents and staff eliciting their input and feedback on how the last few weeks have gone. So far the results have been overwhelmingly favorable. We sent it out to all of our parents and staff members, which is a little over about 2,000, and we're up well over 500 responses already just overnight, and the responses have been very favorable. Very proud of the staff and how they've been able to step up and meet the needs of our students at all levels. Our breakfast program, our breakfast and lunch program continues throughout this crisis. We have deliveries being made at Rosewood from 11:30 to 12:30. The Winthrop School also from 11:30 to 12:30. Agawam Village from 11:30 to 12:15. And then at Powder House Village from 12:15 to 12:30. We're waiting official word on our official assessments for this year. The federal government has given permission nationwide to cancel the assessments for this year. In our case, the MCAS is mandated by law, and so we're waiting for the legislature to vote on that to cancel that for this year. We should hear something about that this week. There's also rumblings, although I haven't seen any official notification about the SAT not being administered as well for the rest of this year. I know that there's been some concern in town about the track and the turf field being closed to the public during the crisis. Beginning tomorrow, the track will be open for walking from 8 to 10 a.m. Monday through Friday. We have some school personnel who have volunteered to be present during this time to enforce social distancing and to keep people actually off the turf itself. The school committee continues its work with regular meetings and subcommittee meetings being held virtually, and the recordings are made available online at the school district website. We do have a school committee meeting scheduled for tomorrow night at 7 o'clock that will be held as a Zoom meeting, and we hope to be able to have it on live, provided we have the technology up and running with ICAM. If you have any questions, please feel free to contact me at bblake@ipsk12.net. And that's it. Thank you.
Thank you, Brian. And now I'm going to pass it over to Colleen Furman, our Public Health Director. As I talked about before, Essex County does have the 784 cases as of today, and we do have 9 cases here in Ipswich, but Colleen's going to elaborate a little bit more on what that means and what we're doing in town with regard to public health.
Thank you, Tony. So as Tony stated, we have 9 cases as of this morning, and the Public Health Department has reached out to each case, and we'll be following up with every close contact that we're aware of. That being said, the case count doesn't really reflect what's happening in the community or in any community in Massachusetts. What's happening now is there are cases, and some people who are close contacts to those cases become symptomatic, and so doctors aren't necessarily performing lab tests on everyone, so they're giving clinical diagnosis and requiring people to go home and isolate. So those cases aren't reflected in the state database, and we're not necessarily made aware of them. So although we do have 9 cases we're aware of, it's likely that there are more cases in the community. The reason why this is important is that we have to continue to practice social distancing and good hygiene practices to mitigate the spread of the virus. As people are interacting even casually and thinking, well, this person isn't symptomatic, it could be that person is actually carrying the virus. We've seen cases of asymptomatic transfer. The other thing is if someone is isolating at home, they really have to be separated as much as they can from the rest of the household members so that they're less likely to transfer that virus. And then anyone in quarantine has to seriously quarantine for a full 14 days. It's often the case that the virus won't show up between 2 and 12 days. So you could be feeling fine for 10 days under quarantine and then suddenly the symptoms appear. So the less people you're in contact with, the better it is for everyone. So you do want to follow strict isolation and quarantine guidelines if you've been notified by a public health department. And just in general, it's community spread virus at this point. So you want to practice social distancing, good hygiene practices, and follow all the orders the governor has been putting out. And that's to help us all mitigate the spread of the virus. In addition, I just want to mention that we do have a lot of resources available at the town, on the town website, having to do with behavioral health. This is a very stressful time for a lot of people. If you have a mental health provider, you should stay in contact with that provider through telehealth. All the providers are switching over to that. If this is something new and you're finding you're struggling with anxiety or depression, there's a lot of resources available on the website. And for anyone in recovery, there's a lot of remote recovery resources available. So please check the Ipswich website, ipswichma.gov. Go to the COVID-19 link at the top, and you'll be able to get all those resources and peruse through them and share them with people that you know could benefit from them. Thank you.
Thank you, Colleen. Okay, right now we're going to take a brief break, and we'll be back with Lieutenant John Hubbard, our Emergency Management Director, and Sheila Taylor, our Council on Aging Director. We'll be right back. Thank you. All right, welcome back. I am joined now with Lieutenant John Hubbard, our Emergency Management Director, and Sheila Taylor, our Council on Aging Director. And sorry, John, ladies first. I am going to start with Sheila today. So Sheila, if you can give us an update what's going on at the Senior Center and what we're doing to help our seniors in town.
Great. We have ramped up a lot of our services this week, and we have found that a lot of people are really hearing the news and understanding that to be safest, we should all stay home if possible. The next 2 weeks are critical. So we've been really pleased that we have been receiving quite a lot of phone calls from people requesting assistance. And we do have volunteers available to help. We do have staff is still all in. We're all working Monday through Friday from 8 to 4. The van is still running, bringing people to the grocery store if they want to, and to pick up prescriptions as well. CADA is still offering medical transportation, but a lot of doctors are now doing telehealth meetings, so the CADA hasn't been quite so busy. Our newest program is in conjunction with Senior Care that we are now doing offering grab and go meals starting Monday. So it's similar to Meals on Wheels in that it's the same food, it's just the delivery is different. So this is for people that are not eligible traditionally for Meals on Wheels, but because of the situation going on now, we are offering a hot lunch for people. We're still working out the details if it's 3 or 4 days, but people are signing up, and you can either pick it up at the Senior Center. We'll have just a parade of cars every day that the lunch is available, and we'll have staff or volunteers fully masked and gloved so that we're maintaining safety and get the meal to your car. Also, we will deliver meals to people that are not comfortable going out, and that will be done on our van or with volunteers depending on the volume that we have. So people can definitely call to sign up for that program. There is no charge. The charge has been waived for this program. So just call the Senior Center for that information. It's 978-356-6650, and we'll do that as long as we need to during this crisis. So we're also working too with the Open Door that has been working great. They are doing curbside pickup as well as delivery of prepackaged food bags. So they are Wednesdays and Thursdays from 11 to 4, and that's another great service. We also have volunteers that are now, we have had a lot of calls for that too. So they are going to grocery stores for people. They'll talk to you, they'll take your list. They will get as much as they possibly can. As we all know, the stores are sometimes in short supply. We've also received some donations that we have at the Senior Center. So you could call us to see if we might have what you've been trying to find and have had trouble. And the volunteers are also doing phone calls just to keep in touch, and that human connection is really what we're all missing right now. So that's been really an important service, and we love to hear too from people, so please call. We're also expanding the cable programs that we offer on the local channels. We have, probably starting next week, you can check the cable schedule to see what's going on, but Patsy Valcour's aerobics class, our seated yoga program, we just taped the Tai Chi program. We'll be taping the French class, so even if you haven't taken French, you might want to try that. So all those will be coming up, so do check the local cable schedule to see when that will happen. And then the final note I just wanted to bring up, last week we talked about the state income tax deadline that has been extended, so that's really good news. So that is now extended, as well as the federal, till July 15th. So we're so hopeful that the AARP volunteers will be back and will take care of everybody that had not yet been helped through the tax program.
Thank you, Sheila. Quick question on the telehealth. Some of our seniors or people that may have not used it before, is there any sort of tutorials or anything out there or practice programs that we can show people how to use it or
Great
assist them with
question.
that?
Great question. We haven't heard of anybody having trouble yet,
Okay.
but we certainly, that could be a new tutorial on the cable channel.
Okay,
to look
this
at,
might be
yeah.
something to think
Yep.
about. Okay, great, thank you.
Yep.
All right, and now we're going to pass it over to Lieutenant John Hubbard to give us an update from our Emergency Management Department.
Thanks, Tony. As far as emergency management is concerned, we've been keeping up to date with MEMA almost on a daily basis, and we participate in their weekly conference call, which is for emergency management officials, and then they have a separate call for law enforcement officials. So we've been maintaining our contact with them. One of the biggest focuses that they've been having with local communities is the lack of PPE or personal protective equipment. Fortunately, here in Ipswich, we haven't had to make a request yet, as we've received 2 significant donations from 2 local businesses, one being Gauthier Insulation and one being True North Ale. They donated several pieces of personal protective equipment, including masks and gloves, to the police department, which we distributed to our first responders and also shared with the fire department. So that way our personnel are protected when we have to go into people's homes to help them with whatever situation they have. So we're very grateful for that because those items are in short supply right now. On the police side of things, the police station still is closed. If you do need to contact us, we recommend that you call us on the phone first. If it is a true emergency that you need to come into the station, you can come in. We'll let you in. We're still here for you. And if you have an emergency, call 911 and officers will respond. Most of the business we're trying to encourage to be done over the phone, though. That's about all.
All right.
Thanks, Tony.
Thank you, John. And as John mentioned, we are thankful to our local businesses, not only for the donations, but also for the ones that are still open, that can stay open, the essential businesses in town, i.e. the restaurants, coffee shops, supermarkets. So please, if you can and you have the means, get out and frequent those businesses. I've been hitting them myself. I get my coffee at Zoomies every morning on the way in, and I get lunch every day out at a different restaurant every time. So they're practicing safe, food handling. They've got gloves on, wearing masks when needed. So the food is being prepared in a safe manner. So I would say, feel free to frequent that if you have the means and want to do that. I know they would appreciate it. And also, with regard to the town services, one thing I forgot to mention was our transfer station. We've opened it 1 additional day. It will be open on Fridays now, along with Wednesdays and Saturdays. People still want to get rid of their leaves and things like that, so we wanted to make sure that it was open an additional day to allow people a little more time to get it done, but also to hopefully practice safe social and physical distancing while they're at the transfer station. So that's it. Please let us know if you have any questions. We're here to help you. We understand these are stressful times, but if we all work together, we will get through this and try to get some normalcy back in our lives. In the meantime, enjoy the time with your family. If you're home alone or not able to have people around, please reach out. We do have services, a phone call away. We'll be here for you. And let us know if you need anything. Your town government is still open and we're still here working for you. So thank you and have a great day.